Hi everyone and welcome. I'm Dr. Eric Bunge and we're going to be demonstrating how to use the R1 Redreactive panel and the Vielight intranasal device at home. They're two wonderful things that we can purchase today, and I want to see everybody in the whole world have red light therapy available to them at home. Whether it's for cognitive wellness, aches and pains, the symptoms of long COVID, just getting older, needing to rejuvenate, I want everyone to have Redreactive and Vielight products in their home because they are the best. We've researched them in our clinic, we've tried them on many people, and we are convinced they are fantastic, and we want to see you get the benefits that red light therapy can give you today. So when we get the Vielight, we're going to open it up, and then we're going to find there's two parts. Okay. There's the unit that drives it, and then the diode. We simply open up the back, slide it open, put the AA battery, and it's ready to go. And then we have the diode, and it just plugs right into the top. And there's a little on and off button right there. It's a very nice diode. And we're going to place it with this diode part here in the nose, and then this is the outside the clip. Some of us might want to take the blue pad off, but most of us so far have just kept the blue pad on. And when we place it there, we can see that the vector of the Vielight 810 intranasal is right towards the bottom of the brain. And in particular, a couple things are very important. Right now we're going to focus on memory and brain fog, and that's with the hippocampus area, which helps us formulate memories. All I do is push it on, there's a little button right there, and that's it. You'll see a couple little lights going off. If it accidentally becomes unplugged, it'll make a couple beepy noises. And we simply start it over again. And it's on a 25-minute timer. For some of us, we'll just do 5 to 10 minutes for the first week, make sure we don't feel yucky. But then we'll eventually, over a month, work it up to the full 25 minutes, and we can do this every single day. We'll turn it off before we take it out. We can clean the diode and the nose piece with alcohol if we need to keep it clean or we want to share it. We simply unplug it. It fits right back into the case nicely, and then it can travel with us. Now for the Redreactive panel, which we have tested and we really have seen great results with this. Not only for long COVID going towards the chest, but neuropathy, putting it on the hair and the head and helping with hair regeneration, putting it on our tummies for either losing weight or vagus nerve stimulation, on hips and knees and shoulders and hands for arthritis pain. This R Redreactive panel is fantastic. And see how light and easy it is to handle? But yet at the same time, it's professional quality and the strongest diodes we can get, plus it has full variable control and a timer. Now, because it is a bright and very powerful red light therapy, if it's aiming right towards our face, maybe we have it here and aiming it towards our neck, or we're trying to do our face and the front of our chest and it's bright, we're going to use one of these sleeping blinds and simply put it over our face. Now, if it's like on our back or on our feet, but we still see a little glare, we can always add a pair of dark sunglasses. Now, the Redreactive is on a 10-minute timer, and simply turning it on will get that started. There is some vents on the side, so make sure you don't block the vents, okay? The fans pull the air in, and this thing does get warm, but it's not over hot. When it's on you, like say, if it starts going from warm to hot, that means move it a little farther away. Now, how far do we usually keep it? Is about 6 inches, okay? About the width of your fist. So if I was trying to help with knee pain, I put it about that far from my knee, okay? If we're using it on our back, about the same thing, about the width of your fist, and it can be a little longer. You know, if we're sensitive, maybe we have like really pale skin or light skin, we can move a little, maybe the hang 5 sign right there. But we've tested it, and it has very good power from 3 inches all the way to 6 and beyond. So wherever we keep it, that's good. And remember, you're going to feel it get warm, but if it starts getting hot, that means we need to go back to that 6-inch distance. The Redreactive panel is unique because we can control the power. See on the back, there's the power button, and there's this little switch here that controls the strength of it. And you can see if we turn it way down, you can actually see it starting to modulate, okay? And that means we turn the frequency down, the duty cycle down, and if we have like a burn, or we have no tan whatsoever, or maybe we have no body fat and we're older, we're gonna turn this down to say like about 100, okay? And then that way it's a lot less power than full power, which we get by clicking the button, and now it's on full power. When we do turn it on, notice that the power control comes on, just click the button and it'll be at full power. On the other side, there is a timer control, and it gets a little weird, but after a while you'll understand how easy it is to use. There's a timer that's turned on, so it's counting down 10 minutes. There is a power button, and then there's a plus and minus. When this thing runs out at the end of 10 minutes, simply hit the plus button and it'll start over for another 10 minutes. So for instance, when we're doing neuropathy, we'll have it for 10 minutes on our low back, then we'll have it for 10 minutes on our legs, upper legs I mean, and then we'll have 10 minutes on our lower legs, and then we'll find a way to have 10 minutes on our feet. If we're doing COVID or long COVID treatments, we'll want it for 10 minutes on the lower chest, 10 minutes on the higher chest, and then the same thing on the back, 10 minutes on the low and 10 minutes on the high. So with the red light panel, we usually keep it about 6 inches away. One of the more popular uses is going to be on your tummy, whether it's helping burn visceral fat or helping improve vagus nerve tone. About this far apart for a good 10 minutes every other day or 2 to 3 times a week. That's how we're going to use that panel. The Vielight, again, 2 to 3 times a week. Some folks do want to do it every day, and that's fine if they've proven that it's comfortable and they're able to use that energy to rejuvenate. The red light panel, when we're using on different areas, I'd say 3 times a week at the most, or 2 to 3 times is great. That stimulates cell rejuvenation, burning calories, regeneration and repair, and like I said, we can do this at home. So I want to close this up and say we're going to have some videos with exercises while we do these, but remember to keep lined up with your posture, learn to exhale and relax, and we'll see you soon on the next video. Thank you.